Good afternoon, everyone. Welcome to this live session. My name is Vijay Mary and I'm working for Lotus Hospitals. Lotus Hospitals is one of the South India's leading hospital, primarily dedicated to continuous scaling affordable medical services for women and children. Lotus provides a multi-pronged approach to treat inpatients and outpatients. So as we are celebrating this World Breastfeeding Week from 1st August to 7th August, supported by the WHO, UNICEF and other health organizations. Why this to provide to support the breastfeeding and helping the mothers to give the breastfeeding in the early 1 to 6 months as much as possible. And the theme of 2023 of the World Breastfeeding Week is enabling breastfeeding, making a difference for working women. Why this theme is important because workplace challenges remains the most common reason for women to never breastfeed or to stop breastfeeding earlier than recommended. Parents need adequate time and support to breastfeed their infants. So in our midst, we have Dr. Vamsidhar Kedar sir working for Kukatpalli unit. Sir has done his MBBS DCH fellow in pediatric intensive care, diploma in allergy and asthma CMC Vellore, fellow in infectious disease pediatrics UK. So sir will be telling us about the breastfeeding, sir. So over to you, sir. Can you tell us what are the about the breastfeeding, like what the people should know about breastfeeding?
So basically, as far as this particular part of medical science is concerned, this is a very unique and a very important phase of every newborn child. So every newborn child who is born on the surface of this planet receives the first feed as the breastfeeding. It contains the nutrients as well as all the other essential things what a newborn child requires. The newborn child doesn't require anything more than what is being given in a breastfeed. So we don't even advise even a drop of water for a newborn children except breastfeeding. It contains the wholesome nutrition, not only that, certain immunological agents in the form of lactoferrin, bifidus bacteria and other things that will enhance the immune system of the newborn child to fight against various viruses and bacteria that are present in the environment. It improves the nutritional status, it helps in growth and development of the newborn child as well as helps the child and the mother in various aspects that we will discuss further in this session. But my sincere request to all those watching out there is to first initiate breastfeeding for every newborn child as early as possible after they are born.
Okay, sir. Now, actually, we have gathered some questions from antenatal mothers as well as the mothers who are giving feeding. So we have some questions like the mother is asking like what benefit she will be gaining like in breastfeeding. So she wants to know the advantages of breastfeeding.
So there are numerous advantages of breastfeeding. Actually, a half an hour session like this is not sufficient, is beyond the scope of this half an hour session to discuss about the lot of advantages of breastfeeding. So I'll just divide the advantages of breastfeeding into two parts. The first part is the advantages to the mother and the second part is advantages to the child. So the advantages to the mother can be summarized as it prevents prevents the onset of breast cancers, ovarian cancers. It helps to reduce the weight that is gained during pregnancy, helps to reduce hypertension, helps to reduce the postpartum depression and also helps very well in attaining the bonding between the newborn child and the mother. So in various ways, considering the psychosocial aspect of the mother passing through the stress of labor and all those things will be completely disappeared by a proper onset of breastfeeding. Not only that, the medical benefits also are numerous. The hormonal changes that take place during breastfeeding help to reduce the incidence of breast cancers, ovarian cancers and also helps the mother to reduce the weight and it acts as a special bond between the mother and the child. So the child always feels reassuring in the arms of the mother while the child is being breastfed. Apart from this, let's talk in brief about the advantages to the infant. Now, coming to the newborn child, as we all know, newborn children vary in their sizes and weight. The newborn child usually are either born preterm or term. Let us make it more easy for you to understand in the layman terms. We call them as a normal weight babies and a low birth weight babies. So the preterm and a term child, the preterm child is the one who has not finished 9 months of gestational age, 36 to 37 weeks of gestational age, and are born before that. They usually weigh less than 2.5 kg. So any child who's weighing less than 2.5 kilograms is termed as a low birth weight child. Going on the other hand, a term child is the one who has finished 37 weeks of gestation in pregnancy and then later they are born. So those babies are usually more than 2.5 kgs unless and until there is an underlying medical factor, and the nutritional requirements of the preterm child and the term child both are quite different. So the protein, the fat, amino acids and other minerals and vitamins that are required by the preterm child are quite different from those required by the term child. So it's the magic of the nature that the mother unknowingly decides upon the various nutrient values that she produces in the form of breast milk and gives it to the child. So the content and the nutritional value of the preterm mother's milk is different from that of a term's milk. See the beauty of the nature here. So it automatically decides what nutrition my child needs, and the breast milk contains those sort of all the value added nutritional factors that help in the rapid growth of the preterm child and helps in the right growth of the term child. So this is what makes it so uniquely important. And moreover, apart from taking into consideration the various nutritional benefits, it has a lot of immunological agents also that helps the child to develop immunologically well, that makes the child or infant immunologically strong, and helps to protect against various environmental infections like bacterial infections, respiratory infections, stomach infections, and all. It also helps to prevent other chronic ailments like obesity, type 1 diabetes, bronchial asthma, etc. So to sum up all these things, the benefits described by giving the breast milk are out of reach of anyone's thought and process. So benefits are there both for the mother as well as for the newborn child. So I sincerely urge all the viewers out there to please continue breastfeeding as long as possible, because the nutritional value outweighs any other benefit in any other form of feed.
Right. Okay, sir. So that and the next question, sir, a mother like who is going to delivery, she's almost at term. She is suffering from tuberculosis, and she's suffering and she's taking medications also. So in this situation, can she breastfeed her child?
Okay, let's discuss in short about certain contraindications for breastfeeding here. So there are very few contraindications for breastfeeding. Usually breastfeeding is indicated in every form and shape for every child, but sometimes, as you know, certain medical conditions they have some antagonistic reactions with the breast milk, and certain metabolites of the medicines also get transmitted through the breast milk into the child. This causes detrimental reactions in the child, and it has a lot of organ effects also. So in these scenarios, we hold the breast milk for some conditions, and the most important of the conditions are if the mother is suffering with a carcinoma of the breast or any other organ like ovarian cancer or breast cancer or stomach related issues or any other carcinoma in the body for which she is taking chemotherapy. So any mother who's taking chemotherapy agents, so these on chemotherapy, the breastfeeding is contraindicated because the metabolites of the drugs that are being given, they pass out from the breast milk and enter the child and damage the organs. So this is one condition. The second condition being if the mother is having HIV, so during HIV infections also it is contraindicated to give breast milk. But now that there are certain recent advances which have changed the topic here, now they usually give antiretroviral therapy, and on antiretroviral therapy, which are some drugs given to the mother in HIV positive patients, when the CD4 counts are normal, the recent advances says that the disadvantages of breastfeeding in these conditions, they are far less when compared to the advantages of breastfeeding. So the recent evidence states that even on HIV, on good treatment and a good cell counts, you can breastfeed. The third contraindication is usually tuberculosis, as mentioned by one of the patients here. Tuberculosis patients, they receive anti-tuberculous therapy. Some of the anti-tuberculous therapy can pass on to the child and causes some sort of a liver problems. So in these conditions also, we abstain the parents to give breast milk to the child. The fourth important thing is sometimes the mother has breast abscess or has undergone a surgery for the breast. In those conditions also, we abstain them, we ask them to abstain from breastfeeding for quite some time. So but overall, the advantages of breastfeeding are far more greater than when compared to all these negligible things. So as far as possible, try not to abstain from breastfeeding. In some very strange scenarios, when I come across talking with the mothers of my small babies, so they usually tell me that they are working, and that is one of the reasons they have mentioned as they have stopped the breastfeeding. So this is really surprising, because there are a lot of other factors that can be taken into consideration. Nowadays, workplace ethics, workplace committees, workplace changes have been made to become conducive for the breastfeeding mothers. In these scenarios, so the mothers can comfortably breastfeed the child, or they can also use certain instruments like breast pump to take the milk and store it in the refrigerator to give them for the babies who are being nursed by somebody else in the house. So breast milk is the best milk, and do never abstain from giving breast milk unless and until the doctor advises so.
So this expressing breast milk and keeping in the refrigerator, how many hours they can store it?
Okay, so when due to any unforeseen circumstances, if the mother is not able to give a direct breast milk, so the breast milk can be pumped out of the breast and then stored in the refrigerator. In these scenarios, usually the breast milk can be stored for around approximately 7 to 8 hours in the refrigerator. Do not keep the bottles in the door of the refrigerator, because every time you open the door and close it, the temperature drops, and this causes a lot of problems, and this causes the temperature variation, and the breast milk becomes denatured. So keeping inside the refrigerator, you can store it for 7 to 8 hours, but caution should be taken whenever you are administering the milk to the child. You need to take it out and then put it in a container which contains hot water for 4 to 5 minutes, so that the milk becomes lukewarm again, and then given to the child.
So, thank you. And sir, the next is actually almost everybody knows, most of them are educated also, still they don't know the benefits of breastfeeding. So can you tell the mothers like how the growth is assessed while giving breastfeeding?
Okay, many a time this is a very important question that is put to me: how to assess the growth of a child during breastfeeding. So we categorize the children as 0 to 3 months, 3 to 6 months, and 12 months of age. So till the first birthday. So here, on an average, we notice for any healthy child, we notice a weight gain of around 15 to 20 grams per day for the first 3 months, followed by 10 to 15 grams per day for the next 3 months, and around 10 grams per day for the next 6 months. So overall, putting it together in a summarized view, the basic requirement that we usually see in a child is twice the birth weight at the end of 6 months and 3 times the birth weight at the end of 1 year. Say for example, if a child is born at 2.5 kgs, so we expect a growth of 2.5 kg, doubling up of the weight for the next 6 months. So that will be 6 kg at the end of 6 months, 5 kg at the end of 6 months, and 7.5 kg at the end of 1 year. So 3 times the birth weight at the end of 1 year. This is how the basic calculation goes. Anything more than that is definitely a bonus on the part of the patient. So but on an average, for the first 6 months, the child gains around 700 to 800 grams per month, and the next 6 months it would be around 400 to 500 grams for the next 6 months.
Okay. Okay, sir. Like the next question is the working women who come for vaccinations in our hospitals, they are usually asking us like they want to go return back to the job. So how long a mother can give breastfeeding?
Ideally, going by a very important aspect of continuation of duration of breastfeeding, the mother can give breastfeeding to as long as 2 years. So in this particular regard, so till 2 years the mother can breastfeed the child, but ideally for the first 6 months it should be an exclusive breastfeeding, no other feeding is required. So but after 6 months, what generally happens is the caloric requirement of the child increases. So 100 ml of milk will give on an average of 67 kilocalories per every 100 ml. So beyond 6 months, when the rate of growth of the child is very fast, the caloric demand is not met by the supply. So here the child requires more calories, and the calories that are supplied by the milk are less. So in this regard, we advise them to go for complementary add-on feeds, and this will make the calorie dense food, and this will help in the rapid growth of the child. So ideally till 2 years, but for the first 6 months it should be an exclusive breastfeeding.
Okay, sir. That's fine. Like, what is it? Any changes in the diet to be taken by mothers who are breastfeeding their child?
Definitely. So, for a mother, usually it is an excess nutrition because they have to take care of themselves as well as they have to take care of the nutritional needs of the child, newborn child. So, in this regard, definitely all the vitamins, minerals, calcium, iron, folate, and all the other essential vitamins and nutrients, not only that, carbohydrate, fat, and protein also, it will be shared between two human beings. So, here the mother has to take care of herself and as well as the nutritional needs of the child. So definitely mother has to take at least 20 to 25% of extra protein, 10 to 15% of extra carbohydrate and fat, as well as extra vitamins and minerals in the form of multivitamin tablets, calcium and iron. This will help not only to sustain the bone strength and the overall health of the mother, and the mother, if the mother is healthy, she can take care of the child. So with due respect to everyone out there, please take all the multivitamin supplements that are prescribed by our gynecologist up to at least 6 to 8 months of your breastfeeding nursing care. That will help to maintain your health as well as the health of your child.
Okay. And during this vaccination injection, sir, like breastfeeding, they're breastfeeding, does it help with the pain management?
It doesn't directly help with the pain management but has an emotional factor behind it. So once we administer a vaccination during the well child checkups, so the child's pain reflexes gets activated, and after the vaccination, immediately if the mother gives a feed to the child, definitely it calms down, soothes down the mind of the child, and the child feels very much reassuring in the arms of the mother. This will help in fighting the pain very effectively and reduction of the pain quotient immediately after the vaccination. But care should be taken not to give the feed when the child is crying actively, because that will help in choking episodes, and sometimes the milk might pass on into the food pipe instead of windpipe instead of food pipe, thereby causing choking episodes.
Okay, sir. So nowadays this conjunctivitis is there in the season. So some mothers are having even conjunctivitis also. In this situation, can they breastfeed their child?
Yes, if the mother is having any minor infections like minor coughs and colds, not on any medication, then the mother can wear a face mask and then feed the child. Now, during the outbreak of viral and bacterial conjunctivitis, the mother can definitely feed the child by wearing proper eye care. So, surgical eye goggles are available in the market, which can be purchased or which can be ordered online, and then they can be worn before giving the feed. That will prevent the eye droplet infection transmission to the child.
Okay, sir. So some mothers wants to know about the medications and breastfeeding. So,
See, as such, coming to the medications, relationship between medications and breastfeeding, usually all the medicines in general that we give for the common colds, coughs, viral fevers, stomach upsets, stomach bugs, and all the other minor ailments, they are usually safe during breastfeeding. Only certain antibiotics or other painkillers and chemotherapeutic agents and certain antiviral therapies, they are only contraindicated. But please don't take a self decision, and please don't search online for any other advice to whether to use or not to use a certain medication during breastfeeding. But I would sincerely recommend, please consult a proper medical professional before you take a decision to start any medication. As such, commonly all the medicines that are used like paracetamol, etc., are basically very safe during breastfeeding.
okay, sir. So some mothers use the breast pump. Usually when they go to offices and all, they use the breast pump and store the milk. So can you elaborate this process?
So as mentioned earlier in my talk just now, so the breast milk for especially for those who are working mothers and who don't have a facility to take the child to the office space and then feed the child there. So definitely breast pump can be used. Breast pump, you can express out the breast milk and stored in the refrigerator for as long as 7 to 8 hours. But only thing, care should be taken before you administer the milk to the child by keeping it in a warm hot water so that the milk becomes lukewarm before you administer to the child.
Okay, sir. And so this first milk, which is known as colostrum, even now also, like some mothers, when we see in the hospital, like mothers, they just throw the elders will throw that first milk, which is colostrum, known as colostrum, which is yellow in liquid, yellow in color. So can you tell me what are the benefits in colostrum and
So
how it helps the infants?
yeah, I actually beg to differ with your ideology over here. Nowadays, by virtue of all the social media and other important personnel, medical professional giving talks on televisions and other shows like this, so awareness has been a lot regarding the production and the utilities of colostrum. So this particular colostrum, which is a thin straw colored fluid which comes before the onset of a proper breast milk, it contains lot of immunologic factors which help the child to fight against all the common bacterial and viral infections of the environment, preventing respiratory infections, gastrointestinal infections, and all the other infections. And this is a very important aspect of a child's life which will kickstart their immune system at the first go of the feed. So care should be taken not to throw it out and give it to the child for a proper growth and development of the child.
Okay, sir. Thank you. That's really nice. And then some ideas on complementary foods along with the breastfeed after 6 months of age.
So regarding a small discussion about the complementary feeds, so usually till 6 months, the golden point rule of thumb is exclusive breastfeeds. So after 6 months, as I have mentioned earlier, the caloric requirements of the child are not met by milk alone. So a complementary feeding has to be started. Ideally, so here I would like to highlight a point that advice on the feed differs from doctor to doctor, because feeding is a subjective phenomenon where we get the feedback from the parents and we decide the course of action based upon the feedback that we get from our patients. So based upon my past experience, ideally rice based diet should be started after 6 months. So till 6 months old it is exclusively breastfed, and after 6 months preferably at the first go rice based diet should be started. Basically because rice based diet is easily digestible when compared to the wheat based diet. So wheat based diet can be started slowly, and once the rice based diet like soft rice based porridge or cereal can be given, so usually it should be started gradually, not to escalate it to large amounts like 4 scoops or 5 scoops every feed. It should be started like 1 scoop 2 or 3 times a day, keeping a gap of 4 to 5 hours between feed to feed. And then once the child is able to chew and swallow well, digest well, and usually once we start complementary feeds, a common issues like a little bit of constipation or throw ups or a little bit of bloated abdomen, these things, a slight abdominal colicky pain, these are all expected. But care should be taken not to overfeed at this point of time, give a break and then start to feed again after 4 to 5 hours. So in this particular way, you can give one to 2 scoops every day and then gradually escalate it to 2 scoops 2 times a day to 3 times a day, and then if the child is able to tolerate it well, then increase it to 3 scoops 3 times a day. And once the child is able to take around 3 scoops 3 times a day, then you can gradually put him on home based diet like locally available rice based diet, or what ideally your grandmother used to cook to you, or what you are used to eating as a child. You can take tips from your parents and grandparents regarding the same. And rice based soft solid diet can be given, like in this part of the country we usually give them with idli, upma, then rice rava and ragi based liquid soft solid diets. So these things can be administered. So rice based diet initially, and then once the child is able to do well, then you can add on fruits with it. Then after that you can add on little bit of ghee and salt, but all those spices, tadkas and other things are contraindicated till first year of life. And gradually once the child is able to take everything well, then you can add on wheat based diets too. Ideally what I tell my patients is not to experiment with more than 2 items in a week. Like for this week, if the child is getting rice based cereal along with dal and chawal, so don't go beyond that in the first week. Then add on some green leafy vegetable along with the dal in the second week, and then you gradually increase not more than 2 items a week. So likewise, once you are in the 4th week, you already have 8 items to take. So based upon that, you change the items. The palate of the child is very unique. They can recognize the taste and the bubble that you are getting near to them, and they start screaming and yelling by the time the bubble comes to them. So usually please see that there is a variation in the taste and the item that you give. Don't give a monotonous feed in the morning, afternoon and evening, so that the child gets bored of it and starts to cry immediately after seeing the food bowl. So likewise, once after the first year of life, the complementary feeding can be added to avoid diverse foods like what you cook in the house. You can start giving everything what you cook for the house. Don't make a separate plate for the child, separate cooking style for the child, as you can reduce a little bit of salt and spices from your diet that makes you healthy as well as the child healthy. So you can cook from the similar for the same pot after the first birthday and give the child the same feed with a little bit softer consistency. This will help a lot in improvement of the child's appetite, child's taste buds, and he starts experimenting on the various foods and start accepting the various foods. Likewise, once you start that, for non-vegetarians, you can also start with fish, boiled egg and chicken between 12 to 15 months, and slowly add mutton after 24 months.
So that's really nice, sir. I think almost all the points sir has covered, and you have explained us in a very clear manner. So, like any advice to be given to antenatal and postnatal mothers, sir?
So for all those antenatal and postnatal mothers out there, my only request to you is try to get a proper breastfeeding consultation done by a good lactation specialist, even during pregnancy and immediately after the pregnancy, so that your ideologies, your doubts, your all your thoughts regarding that are channelized, and the channelized energy can be given to the baby. So this is a very unique concept here, and this is in human beings across this planet, this is one of the most wonderful phenomenon to adequately nurture your child to become a good and healthy individual.
Thank you so much, sir. Sir, in spite of having a very busy schedule, sir has completed IP visits and then OP patients, sir, and I came all the way to tell us about this breastfeeding topic, which was very interesting. And I think almost all the viewers who have seen this have gained much knowledge regarding breastfeeding. So thank you very much, sir.
Thank you. Thanks a lot.